room, and I'm just going to take a moment to, just a very brief moment to review my chart. This morning I am here to see Josephine Johnson. She was admitted with atrial fibrillation and pneumonia. So I am now ready to go into my patient's room.
Come in.
Good morning, Josephine.
Good morning.
It's Jane. I'm your student nurse with St. Cloud State University. How are you doing this morning?
I'm good. And yourself?
I'm doing well. Thank you. Josephine, the reason I'm here this morning, I'm going to go ahead and do a few assessments. I'm going to take your vital signs.
Okay.
I'd like also to see how your pain level is doing this morning. I will exit the room briefly. I'm going to go ahead and set up your 8 o'clock medications, and then I'll come back and complete a head-to-toe assessment. Do you have any questions about what I'm planning to do?
No.
No? All right. Josephine, before I start with everything, could I just please take a look at your wristband here? And could you please state for me your full name?
Josephine Johnson.
All right. And that medical record number matches. Josephine, also, do you need to use the bathroom before I start with anything?
No, I went before you came in.
Went before? Okay, sounds good. And are you in a comfortable position?
Yes, I am.
All right. And as long as I'm asking a couple questions in regard to pain and or discomfort, are you experiencing any pain this morning?
I'm just stiff from laying all night.
Just stiff from laying all night. And where exactly are you stiff?
Just in my back.
In your back.
Yeah.
Now, if you were to rate that on a scale of 0 to 10, 0 being no pain, 10 being the most pain ever, where would you put your pain? In
1
your
to
back?
2.
A 1 to 2. Okay, so fairly mild.
Yep.
What seems to assist with that or help with the pain?
Getting up out of bed.
Getting up and out of bed?
Yeah.
Okay, so when I come in after giving our medications this morning, would you like to get up before breakfast and sit in the chair?
That would be great.
Okay, so we can try that. All right, Josephine, I'm going to go ahead then and just flip the bed up here.
Okay.
And I'm going to go ahead and take a set of vital signs. First, I'll start with the temperature. Have you had anything to eat or drink this morning?
Nope, I took my pills at 6.
Okay. All right, so I'm just going to go ahead and get your temperature. Place that under your tongue. And beep. Okay, so Josephine, that's 98.6. I think I took my garbage over. So let's just say it's in the garbage.
Okay.
All right, so that temperature is normal. Next, Josephine, I'm just going to go ahead and take your pulse. And I'm going to move through some of the vitals, just again in lieu of us videoing, if you're all okay with that, so that we don't get bogged down on time that way. So you'll do all the set of vitals on the mannequin. So again, I'm just going to kind of move through that. All right, Josephine, your heart rate is 80.
Okay.
Respirations are 16. Both, again, are normal and within your baseline.
Okay.
All right. Next, Josephine, I'm going to go ahead and listen to your apical pulse. Just going to warm that up. All right, Josephine, and your apical pulse is 80. That's also regular and within defined limits. Next, Josephine, I'm going to go ahead and just take your blood pressure. All right, Josephine, blood pressure this morning 120 over 82. And that does seem to be consistent, again, with your baseline. Now, one thing also that I'm going to go ahead and take here, Josephine, is just get your oxygen saturation levels. While I'm doing that, while that is reading, are you having or experiencing any shortness of breath this morning?
No, yesterday I did.
Yesterday, but that seems to be better now this morning?
Yep, I coughed up a lot of sputum.
Okay, and what color was that sputum?
Kind of greenish tan.
Okay, all right.
Not like when I first came in.
Not like when you first came in. Okay. So this morning your oxygen saturation levels are 92%, so that seems to be appropriate. Now, what would you do if it's less than 90?
Check if you have an order for oxygen.
Check to see if you've got an order. What would be some of your interventions that you might promote for oxygenation? Yep, maybe set the bed up a little bit
Take some deep
higher,
breaths.
inquire about shortness of breath. You know, so if the reading is 86%, you should be asking me questions. Am I short of breath? Can I catch my breath? Any difficulty breathing? You know, chest heaviness. So go through your questions. That's where, again, you're going to want to pause and just kind of think about the values and what you're getting, right? Use your green sheet then to document all that, because again, as you look at that green sheet, if you follow it and if you document your findings on there, are you going to miss something? Likely not, correct? Because it should be on the sheet, right? So I've covered pain, I've covered vitals. Have I forgotten any vitals? I think I did temp, radial pulse, respirations, apical, blood pressure. Again, go down that list and document your findings so you don't forget something. So Josephine, I'm all done with my vital signs. Now, can you tell me where you are this morning?
I think I'm at St. Cloud Hospital.
That is correct. You're at the St. Cloud Hospital. You're on a medical unit. And do you know what date is today?
Well, everybody was wearing green yesterday, so I'm
Yesterday?
thinking it's the day after St. Patrick's Day.
That is correct. It is March. What is the date today, Dave?
18th.
I'm off schedule. March 18th. All right. Josephine, I see that your IV is on your left hand, so I'm just going to take a moment to double check that. So again, here's part of the line assessment, right? Excuse me, sorry, Christine. So what you'll do is you'll ask faculty some questions about the IV, much like what you would do in the clinical setting. So Josephine, I see you've got your IV here in your forearm. There is no redness, there's no drainage. Is there any tenderness at all?
Nope.
No.
Nope.
Now, we're saying that this line is connected. Right now, I know it's in the garbage, but we're just gonna say it's connected. We've got a continuous line running. And what you're gonna need to do is you need to use your chart to verify that what is programmed in here and the solution that's hanging is the correct order. Don't use your green sheet and don't use memory. You have to use the chart, okay? So Josephine, I'm just gonna verify that what I have here is correct. So I have 0.9 normal saline at 25 an hour. It is at 25 an hour. And I have 0.9 normal saline, and I have a valid or a good expiration date. Okay. That's how you're gonna wanna check it, and that's what you're gonna do in clinical. Now in clinical, the only difference would be that we would give you a scanner, and if your patient has a continuous IV, we're gonna take that scanner and we're gonna do a rate verify. And we'll go through some of that in EPIC training next week. But you still have to evaluate the site or assess the site, follow that line through and to the pump, verify the rate, verify the solution. Okay, so that's what that's gonna look like. So then to recap, I have entered the room. I have done a complete set of vitals, and I've made some decisions about the vitals, and they were all within defined limits. That those vitals included oxygen saturation level. I did a line assessment. I did an airway assessment. From my prep, I know that my patient does not have a drain. So LDA, the line drain airway. My airway assessment, again, oxygen saturation levels, breathing, dyspnea, anything of that nature. Then let's see, I did pain assessment, if I didn't already mention that, and then again, cognition. Where is the patient? And so on. Any questions yet? Okay. So Josephine, that concludes all the vitals. I've reviewed your IV. I am going to go ahead and get all of your 8 o'clock medication set up. And that'll take me just about 20 minutes, then I'll come back in the room. Are you in a comfortable position?
Yes.
Josephine? Yes?
Yes.
Okay. And I already asked about pain, and so again, the plan would be that when I come back in after medications, we'll go ahead and sit you up in the chair.
I dozed.
Pardon?
I dozed for a little bit.
And your call light is here, so should you need something before I come back, just go ahead and push that call light. And so I'll be back. All right. Then, let's just say for purposes of videoing, I'm just going to kind of keep my table like this. So you're out of the patient room, and you're going to go ahead and set up meds. So that first thing that you're going to do is, again, much like what we've been doing in our other activities, you're just going to compare that what's on the order sheet matches the MAR. All right, so I have ferrous sulfate 325 daily. I have Coumadin 5 daily. Erythromycin 250 to be given every 6 hours. Digoxin 0.25. Hold if the apical pulse is less than 60. This morning the apical pulse was 80, so I'm going to go ahead and plan to give that. Metformin is 500. I know that's a blood glucose medication. It's an oral agent. And looking at the lab values, the PCA this morning took that blood glucose level, and it's 130. I'm going to plan to administer that medication. And then I have 0.9 normal saline at 25 an hour continuously. And when I was in the room, I did my checks on that, and that does match. My patient does not have any PRN medications because I've scanned to the very bottom of that sheet, and there is nothing on there. All right, so I'm going to go ahead and get my meds set up. All right, so I have ferrous sulfate. All right, so check number 1, ferrous sulfate 325 daily at 0800. It's not yet been given. For Josephine Johnson, date of birth and med rec number match. I have a good expiration, and I've reviewed why my patient is getting this for congestive heart failure, atrial fibrillation, and I have noted an allergy to Ativan that will not interfere with my med. So, 1 tablet. So I have ferrous sulfate, so second check, 325 in every tablet to be given daily. It's not yet been given for Josephine Johnson, date of birth and med rec number match. I have a good expiration. I've reviewed why she's getting it, and I've noted the allergy. Third and final check, ferrous sulfate 325 to be given daily with 1 tab here at 0800. Not yet been given on today's date. Date of birth, med rec number match. My expiration date is good. I've reviewed why, and I've noted the allergy to Ativan. My patient is on Coumadin, but not receiving that till 5 p.m., so I'm not going to set that up. Next med, erythromycin, check number 1. Erythromycin, 250 milligrams in every capsule to be given every 6 hours. Last administered at 2 in the morning. It's 0800, not yet been administered. On today's date, for Josephine Johnson, date of birth and med rec number match. My expiration is good. Patient is taking this for the pneumonia, and I've noted the allergy to Ativan does not interfere with anything in terms of this medication, so I'm going to go ahead and get that set up. Second check, erythromycin 250 in every capsule. It's what I have to be given every 6 hours. Last given at 2 in the morning. It's 0800, not yet been given. Josephine Johnson, date of birth and med rec number match. I have a good expiration. Patient is receiving this for pneumonia. I have noted the allergy. Third and final check, erythromycin 250 every 6 hours for 0800, not yet been given on today's date. For Josephine Johnson, med rec number, date of birth match for pneumonia, and then I've noted the allergy to Ativan. Next med, digoxin. Check number 1, digoxin 0.25 to be given every day at 0800 here. It's not yet been given. Today's date for Josephine, date of birth, med rec number match. I have a good expiration. Taking this for the atrial fibrillation. I've noted the allergy to Ativan. Apical pulse was 80 earlier, so I'm going to go ahead and get that set up. So, digoxin, I have 0.25 in every tablet to be given daily at 0800. Today's date for Josephine Johnson, date of birth, med rec number match. I have a good expiration. I've noted why the patient is getting it, and I've reviewed that allergy. Third and final check, digoxin 0.25 to be given daily. Hold of apical pulse is 60. Again, it was 80, so I'm going to go ahead and give that. It's not yet been given. For Josephine Johnson, date of birth and med rec number match. I've noted why, and I've reviewed the allergy. All right, last but not least, I have metformin. Just one more glance. I'm going to take a look at that blood glucose reading. So I've reviewed it, 120. I'm going to plan to go ahead and administer that med. So check number 1, metformin 500 to be given twice a day. It's not yet been given at 0800. For Josephine Johnson, date of birth and med rec number match. My expiration is good. Patient is receiving this for the non-insulin dependent diabetes, and the allergy is noted. So again, I